Question 1. The evaluation methodology shows a pattern of reported concerns regarding Dr. Anya Sharma's communication with nursing staff, specifically concerning timely and clear verbal orders for complex patient care. These reports, while not yet formal complaints, have been raised by multiple nurses over the past 2 months. The Medical Staff Services Director is aware of these informal reports and needs to determine the most appropriate initial course of action to address the situation effectively and compliantly. Option A. Advise the nursing staff to document every instance of perceived poor communication and to avoid direct verbal orders with Dr. Sharma until a formal complaint is filed. Option B. Initiate a formal review process, including gathering documentation of the reported incidents, speaking with the reporting nurses to understand the specifics, and scheduling a meeting with Dr. Sharma to discuss the concerns in a non-confrontational manner, emphasizing the hospital's commitment to clear communication protocols and patient safety. Option C. Immediately place Dr. Sharma on a probationary status pending a full investigation, requiring all verbal orders to be documented in writing before being acted upon by nursing staff. Option D. Schedule a meeting with Dr. Sharma to express personal disappointment with the reported behavior and suggest she make a more concerted effort to communicate better without formally documenting the discussion. Correct answer is B. Initiate a formal review process, including gathering documentation of the reported incidents, speaking with the reporting nurses to understand the specifics, and scheduling a meeting with Dr. Sharma to discuss the concerns in a non-confrontational manner, emphasizing the hospital's commitment to clear communication protocols and patient safety. Explanation. This scenario presents a professionally challenging situation due to the inherent conflict between a physician's perceived autonomy and the hospital's need to maintain patient safety and adherence to established protocols. The medical staff services professional must navigate this conflict while upholding regulatory requirements and ethical obligations. Careful judgment is required to ensure that the resolution process is fair, objective, and compliant with the hospital's bylaws, credentialing policies, and relevant state and federal regulations governing healthcare quality and physician conduct. The correct approach represents best professional practice because it directly addresses the reported concerns through a structured, objective, and confidential process. This aligns with the principles of due process and fair hearing, as typically outlined in medical staff bylaws, and supported by regulatory frameworks that emphasize accountability and quality improvement. By initiating a review that involves gathering information, assessing the physician's performance against established standards, and facilitating a dialogue, the medical staff services professional is acting in accordance with their duty to protect patient welfare and ensure the integrity of the medical staff. This process respects the physician's rights while prioritizing the institution's responsibility to maintain a competent and safe medical staff. An incorrect approach that involves immediate punitive action without a thorough investigation would be a regulatory and ethical failure. Such an action bypasses the established due process mechanisms, potentially violating the physician's rights and leading to legal challenges. It also fails to identify the root cause of the performance issues, hindering opportunities for remediation and improvement. Another incorrect approach, such as ignoring the concerns to avoid conflict, is a significant ethical and regulatory failure. This inaction directly jeopardizes patient safety and exposes the hospital to liability. It also undermines the credibility of the Medical Staff Services Department and the hospital's commitment to quality care. Furthermore, a failure to maintain confidentiality throughout the process would violate privacy regulations and erode trust among medical staff members. Professionals should employ a decision-making framework that begins with understanding the reported issue and its potential impact. This involves consulting relevant policies, bylaws, and regulations. The next step is to gather objective information in a systematic and unbiased manner. Facilitating open communication where appropriate and safe is crucial. The resolution should be based on evidence and established standards, with a clear plan for action, whether that involves education, remediation, or disciplinary measures. Throughout the process, maintaining confidentiality, objectivity, and adherence to due process is paramount. Question 2. Cost-benefit analysis shows that implementing a full Plan Do Study Act (PDSA) cycle for a new patient handoff protocol might incur higher upfront training and data collection costs compared to a simplified, less data-intensive approach. However, The Medical Staff Services Department is concerned about the potential for incomplete implementation and overlooking critical safety issues if the full PDSA cycle is not rigorously followed. Which course of action best upholds the principles of quality improvement and patient safety within the regulatory framework for medical staff services? Option A. Implement the new handoff protocol with minimal training and rely on anecdotal feedback from staff to gauge its effectiveness, deferring any formal data collection until later. Option B. Proceed with the full Plan-Do Study Act cycle, allocating necessary resources for comprehensive training and data collection to ensure thorough evaluation and refinement of the new handoff protocol for full implementation. Option C. Adopt the simplified, less data-intensive approach to minimize immediate costs, assuming that any significant issues will be identified through routine incident reporting. Option D. Postpone the implementation of the new handoff protocol indefinitely until a more favorable cost-benefit analysis can be achieved, without exploring alternative, less costly but still robust, quality improvement methods. The correct answer is B. Proceed with the full Plan-Do Study Act cycle, allocating necessary resources for comprehensive training and data collection to ensure thorough evaluation and refinement of the new handoff protocol for full implementation. Explanation. This scenario presents a common ethical dilemma in healthcare quality improvement, where financial considerations may conflict with patient safety and best practices. The challenge lies in balancing the perceived cost savings of a less rigorous approach with the potential risks to patient care and the organization's commitment to continuous improvement. The correct approach prioritizes patient well-being and adherence to established quality improvement methodologies, even if it requires additional resources. This aligns with the core ethical principles of beneficence and non-maleficence, as well as the regulatory expectation for healthcare organizations to actively engage in quality improvement to ensure safe and effective patient care. Utilizing a structured, evidence-based model like PDSA, even when initial cost-benefit analysis suggests otherwise, demonstrates a commitment to thoroughness and patient safety, which is paramount in medical staff services. This approach upholds professional standards and regulatory compliance by ensuring that quality initiatives are robust and data-driven, rather than being prematurely curtailed by short-term financial projections. An incorrect approach that focuses solely on immediate cost reduction without fully implementing the PDSA cycle would fail to adequately identify and address potential issues. This could lead to the adoption of suboptimal practices or the overlooking of critical safety concerns, directly violating the principle of non-maleficence. Furthermore, bypassing the study and act phases of PDSA undermines the scientific rigor expected in quality improvement, potentially leading to ineffective interventions and wasted resources in the long run, and could be viewed as a failure to meet regulatory requirements for systematic quality assessment and improvement. Another incorrect approach that might involve anecdotal evidence or superficial changes to bypass the structured data collection and analysis inherent in PDSA would be ethically problematic. This approach risks making decisions based on incomplete or biased information, which can lead to unintended negative consequences for patient care. It also fails to establish a culture of data-driven decision-making, which is a cornerstone of effective quality improvement and a regulatory expectation. The professional decision-making process in such situations should involve a thorough understanding of the PDSA model and its importance in achieving sustainable quality improvements. It requires advocating for the necessary resources to properly execute each phase of the model, even when faced with financial pressures. Professionals should be prepared to articulate the long-term benefits of a robust quality improvement process, including enhanced patient safety, improved outcomes, and reduced costs associated with errors and inefficiencies to stakeholders. Ethical considerations, particularly the duty to protect patient welfare, must always supersede purely financial motivations when they conflict with patient safety and quality of care. Question 3. Assessment of which regulatory body's requirements takes absolute priority for a hospital participating in the Medicare program when a specific credentialing or privileging mandate is in question. Option A, the Joint Commission TJC. Option B, Centers for Medicare and Medicaid Services CMS. Option C, State Department of Health. Option D, Internal Hospital Policy Committee. The correct answer is B, Centers for Medicare and Medicaid Services CMS. Explanation: scenario analysis. This scenario is professionally challenging because it requires the medical staff services professional to navigate the complex interplay between different regulatory bodies and their specific mandates. The challenge lies in understanding which body's requirements take precedence in a given situation, especially when there might be perceived conflicts or overlapping jurisdictions. Accurate interpretation and application of these regulations are critical to ensuring patient safety, compliance, and the integrity of the medical staff credentialing and privileging processes. Misinterpretation can lead to significant legal and operational repercussions for the healthcare organization and its medical staff. Correct approach analysis. The correct approach emphasizes the primacy of the Centers for Medicare and Medicaid Services, CMS, regulations when it comes to Medicare participating hospitals. CMS sets the conditions of participation, COPS, that all such facilities must meet to receive reimbursement. These conditions often dictate specific requirements for medical staff organization, credentialing, privileging, and ongoing professional practice evaluation. While the Joint Commission, TJC, is a significant accrediting body that also sets standards for patient care and safety, and its standards are often used by CMS to survey hospitals, CMS regulations are the ultimate federal authority for Medicare reimbursement. Therefore, when a direct conflict or a specific requirement is mandated by CMS, its regulations must be followed to maintain Medicare participation. This approach reflects best professional practice by prioritizing the foundational federal requirements that directly impact the organization's ability to serve patients and operate financially. Incorrect approach is analysis. One incorrect approach would be to solely rely on the Joint Commission standards without considering CMS requirements. While TJC standards are robust and often exceed CMS requirements, they are an accreditation standard. If TJC standards were to deviate from or not fully encompass a specific CMS mandate, adherence only to TJC would still leave the hospital non-compliant with CMS COPS, jeopardizing Medicare reimbursement. This represents a regulatory failure by overlooking a higher-tier federal requirement. Another incorrect approach would be to prioritize internal hospital policies over both CMS and TJC regulations. Internal policies are designed to operationalize and sometimes enhance regulatory requirements, but they cannot supersede them. If an internal policy conflicts with a CMS COP or a TJC standard, the internal policy is invalid in that regard. This is a significant regulatory and ethical failure, as it undermines the established frameworks for patient safety and quality of care. A third incorrect approach would be to assume that accreditation by TJC automatically confers full compliance with all CMS requirements without specific verification. While TJC's accreditation process is designed to align with CMS standards, there can be nuances and specific interpretations of CMS regulations that require direct attention. Over-reliance on the accreditation status without understanding the underlying CMS mandates can lead to gaps in compliance. This is a failure of due diligence and a potential regulatory oversight. Professional reasoning. Medical staff services professionals must adopt a hierarchical approach to regulatory compliance. They should first identify the applicable federal regulations, such as CMS COPS, as these often represent the baseline requirements for participation in federal programs. Next, they should consider accreditation standards from bodies like the Joint Commission, understanding that these standards are often designed to meet or exceed federal requirements and are crucial for accreditation. Finally, internal policies should be reviewed to ensure they are aligned with and support both federal and accreditation standards. When faced with potential conflicts, professionals should consult legal counsel and relevant regulatory guidance to determine the governing requirements. Continuous education and staying abreast of updates from all relevant bodies are essential for maintaining compliance and ensuring the highest standards of patient care and medical staff governance. Question 4. Comparative studies suggest that the effectiveness of medical staff credentialing and privileging processes is heavily influenced by adherence to established organizational governance documents. A physician submits an application for new privileges at a hospital. Upon initial review by the Medical Staff Services Department, it is noted that the application is missing several required supporting documents as explicitly listed in the hospital's bylaws, and the description of the requested privileges is vague and does not clearly align with existing privilege categories defined in the rules and regulations. The Medical Executive Committee, MEC, is scheduled to review this application at its next meeting. What is the most appropriate course of action for the medical staff services professional? Option A. Advise the physician to withdraw the application and resubmit it at a later date after they have gathered all necessary documentation and clarified their request. Option B. Return the application to the physician without prejudice, clearly stating the specific missing documentation and the need for clarification on the requested privileges, referencing the relevant sections of the bylaws and rules and regulations. Option C. Present the incomplete application to the MEC for their review and decision, highlighting the missing information and vague privilege descriptions. Option D. Proceed with granting the privileges based on the physician's reputation and informal discussions with department chairs, as the MEC meeting is imminent. The correct answer is C. Present the incomplete application to the MEC for their review and decision, highlighting the missing information and vague privilege descriptions. Explanation. Scenario analysis. This scenario presents a common challenge in medical staff services, balancing the need for efficient credentialing and privileging processes with the imperative to adhere strictly to established bylaws and rules and regulations. The Medical Executive Committee, MEC, is tasked with reviewing a physician's request for new privileges, but the request itself is incomplete and potentially deviates from established criteria. The challenge lies in determining the appropriate course of action without compromising due process for the applicant or the hospital's commitment to patient safety and regulatory compliance. The medical staff services professional must navigate the organizational governance structure and the specific requirements outlined in the bylaws. Correct approach analysis. The correct approach involves a meticulous review of the submitted application against the hospital's bylaws and rules and regulations. This ensures that the process is fair, consistent, and legally defensible. Specifically, the medical staff services professional must verify that the applicant has provided all required documentation as stipulated in the bylaws for the requested privileges. If the application is incomplete or if the requested privileges are not clearly defined or supported by established criteria within the bylaws, the professional's responsibility is to communicate these deficiencies to the applicant and the MEC, recommending that the application be returned without prejudice pending correction or clarification. This upholds the principle of due process, ensuring the applicant has a clear understanding of what is required and an opportunity to rectify any omissions. It also protects the hospital by ensuring that credentialing decisions are based on complete and accurate information, aligning with the standards set forth in the bylaws, which are foundational to the medical staff's self-governance and regulatory compliance. Incorrect approaches analysis. One incorrect approach would be to present the incomplete application to the MEC for a decision, implying that the MEC should somehow figure it out or make assumptions. This is a regulatory failure because it bypasses the established procedural requirements for credentialing outlined in the bylaws. It also creates an ethical failure by potentially leading to an uninformed decision that could compromise patient safety if privileges are granted without proper vetting. Furthermore, it undermines the integrity of the credentialing process and the authority of the bylaws. Another incorrect approach would be to unilaterally reject the application without providing the applicant with specific reasons or an opportunity to correct deficiencies, especially if the bylaws allow for resubmission after correction. This constitutes a failure of due process, a fundamental ethical and regulatory principle. It can lead to legal challenges and damage the hospital's reputation. The bylaws typically outline a clear process for application submission and review, and deviating from this without justification is a significant procedural error. A third incorrect approach would be to grant the privileges based on informal discussions or assumptions about the physician's competence, without the formal documentation and review process mandated by the bylaws. This is a severe regulatory and ethical failure. It directly contravenes the hospital's governance documents, bypasses the established peer review process, and poses a direct risk to patient safety by not ensuring that the physician meets the defined standards for the requested privileges. Professional reasoning. Professionals in medical staff services must prioritize adherence to the organization's governing documents, primarily the bylaws and rules and regulations. When faced with an incomplete or questionable application, the decision-making process should involve 1. Thoroughly reviewing the bylaws and rules and regulations to understand the specific requirements for the requested privileges and the application process. 2. objectively assessing the submitted application against these established criteria. 3. Clearly identifying any deficiencies or ambiguities. 4. Communicating these findings professionally and precisely to the applicant and the relevant committee, in this case, the MEC, outlining the specific requirements that have not been met and the recommended course of action, e.g., return without prejudice pending correction. 5. Documenting all steps taken and communications made. This systematic approach ensures fairness, transparency, and compliance, safeguarding both the applicant's rights and the organization's commitment to quality patient care. Question 5. The performance metrics show a slight increase in patient complaints related to communication for a newly credentialed surgeon in the orthopedic department. The Medical Executive Committee, MEC, is considering how to initiate a focused professional practice evaluation, FPPE, for this physician. Which approach best aligns with regulatory requirements and best practices for FPPE implementation? Option A. Initiate a targeted FPPE focusing on objective criteria such as chart audits of communication documentation, review of patient satisfaction surveys specifically addressing communication, and direct observation of patient interactions during clinic hours, with a clear plan communicated to the physician. Option B. Implement a broad, general FPPE checklist covering all aspects of physician practice, regardless of the specific complaint. To ensure comprehensive coverage, Option C. Postpone the FPPE until a pattern of more significant clinical issues emerges, as the current metrics are only a slight increase and may be attributable to external factors. Option D. Rely on informal discussions with colleagues who have interacted with the surgeon to gather feedback, as this is often faster and less confrontational. Correct answer is A. Initiate a targeted FPPE focusing on objective criteria such as chart audits of communication documentation, review of patient satisfaction surveys specifically addressing communication, and direct observation of patient interactions during clinic hours, with a clear plan communicated to the physician. Explanation. This scenario presents a common implementation challenge in medical staff services, balancing the need for robust, focused professional practice evaluation, FPPE, with the practical realities of physician workload and potential resistance. The challenge lies in ensuring the FPPE process is both effective in identifying potential practice issues and efficient enough to be sustainable and accepted by the medical staff. The core tension is between thoroughness and feasibility. The correct approach represents best professional practice because it prioritizes a systematic, data-driven, and collaborative method for FPPE. It acknowledges that FPPE is not a punitive measure, but a developmental tool. By involving the Medical Executive Committee, MEC, and the Chief of Service, it ensures buy-in and aligns the FPPE process with the hospital's overall quality improvement goals. Focusing on specific, objective criteria derived from the initial credentialing application and peer review data ensures the FPPE is targeted and relevant, avoiding a fishing expedition. This aligns with the principles of fair process and due diligence expected in medical staff governance. An incorrect approach that focuses solely on anecdotal concerns without objective data fails to meet regulatory requirements for a structured FPPE. Regulatory frameworks typically mandate that FPPE be based on objective criteria and a defined process, not subjective impressions. This approach risks being perceived as biased or retaliatory, undermining trust and potentially leading to legal challenges. Another incorrect approach that delays the FPPE process indefinitely due to perceived administrative burden is also professionally unacceptable. The purpose of FPPE is to proactively assess a practitioner's competence within a defined timeframe after initial appointment or a significant change in privileges. Delaying this process negates its preventative and developmental value and violates the spirit and often the letter of regulatory requirements for timely evaluation. A third incorrect approach that relies on a generic, one-size-fits-all FPPE checklist without tailoring it to the specific specialty or privileges requested is also flawed. Effective FPPE requires a degree of specificity to be meaningful. While standardization is important, the evaluation criteria must be relevant to the scope of practice being assessed. A generic checklist may miss critical aspects of a physician's performance in a particular specialty, rendering the FPPE less effective. The professional reasoning process for similar situations should involve 1. understanding the specific regulatory requirements for FPPE in the relevant jurisdiction. 2. Identifying the objective criteria for evaluation based on the physician's application and the scope of privileges. 3. Developing a clear documented FPPE plan with defined timelines and responsibilities. 4. Communicating the FPPE process transparently to the physician. 5. Gathering objective data throughout the FPPE period. 6. Reviewing the data collaboratively with relevant committees and the physician. 7. Making a recommendation based on the findings and ensuring appropriate follow-up. Question 6. To address the challenge of a physician's reappointment request where the Credentials Committee has forwarded concerns alongside the application, what is the most appropriate course of action for the Medical Executive Committee, MEC, to ensure a fair and compliant decision that prioritizes patient safety? Option A. Immediately deny the reappointment based on the unsubstantiated rumor mentioned in the Credentials Committee's concerns. Option B. Approve the reappointment without further discussion, assuming the Credentials Committee would have flagged any significant issues. Option C. Conduct a thorough review of the physician's entire credentialing file, including the Credentials Committee's findings and any supporting documentation, and seek further clarification if necessary before making a recommendation. Option D. Defer the final decision solely to the Chief of Service, as they are most familiar with the physician's performance. The correct answer is C. Conduct a thorough review of the physician's entire credentialing file, including the Credentials Committee's findings and any supporting documentation, and seek further clarification if necessary before making a recommendation. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the Medical Executive Committee, MEC, to balance the need for efficient hospital operations and patient safety with the rights and responsibilities of individual physicians. The MEC must act as a gatekeeper, ensuring that only qualified practitioners are granted privileges, while also fostering a collaborative environment. Navigating potential conflicts of interest, ensuring due process, and adhering to established policies and regulatory requirements are paramount. The challenge lies in making decisions that are objective, evidence-based, and defensible, particularly when those decisions impact a physician's ability to practice. Correct approach analysis. The correct approach involves the MEC meticulously reviewing the credentialing file, seeking clarification from the Credentials Committee, and ensuring all relevant information, including peer recommendations and any adverse findings, is thoroughly considered. This aligns with the MEC's core responsibility as outlined in medical staff bylaws and regulatory frameworks, such as the Joint Commission Standards for Medical Staff Credentialing and Privileging. The MEC must ensure that decisions are based on objective criteria related to competence, ethics, and professional conduct, and that the process adheres to principles of fairness and due process. This systematic review and information gathering process upholds the integrity of the credentialing process and protects patient safety by ensuring practitioners meet established standards. Incorrect approaches analysis. One incorrect approach involves the MEC immediately denying the reappointment based on a single, unsubstantiated rumor. This fails to adhere to due process, which requires a thorough investigation and opportunity for the applicant to respond. It also bypasses the established credentialing and privileging process, potentially violating medical staff bylaws and regulatory requirements for fair and equitable treatment. Another incorrect approach is for the MEC to defer the decision entirely to the Chief of Service without independent review. While the Chief of Service's input is valuable, the MEC has ultimate responsibility for credentialing and privileging decisions. Abdicating this responsibility undermines the MEC's oversight function and could lead to inconsistent or biased decisions, failing to meet the standards of objective review required by regulatory bodies. A third incorrect approach is to approve the reappointment without addressing the concerns raised by the Credentials Committee. This ignores potential red flags regarding a physician's competence or professional behavior, directly jeopardizing patient safety and failing to uphold the MEC's duty to protect the hospital's patients. It also violates the principle of diligent oversight and adherence to established risk management protocols. Professional reasoning. Professionals facing such a situation should first consult the organization's medical staff bylaws and relevant accreditation standards, e.g., Joint Commission. They should then follow a structured process, gather all pertinent information, Ensure the Credentials Committee has completed its review. Seek clarification on any ambiguous findings, and allow the applicant due process. Decisions must be based on objective evidence of competence and professional conduct, documented thoroughly and communicated according to policy. This systematic approach ensures fairness, compliance, and ultimately, patient safety. Question 7. Risk assessment procedures indicate a potential for expedited credentialing of a new physician in a high-demand specialty due to urgent patient care needs. The Medical Staff Services Department has received the physician's application, which includes self-attested information regarding licensure, board certification, and malpractice history. The department director is considering allowing the physician to begin seeing patients under temporary privileges while the full primary source verification process is underway, provided the department chair verbally confirms the physician's competence. Which of the following approaches best aligns with regulatory requirements and best practices for medical staff credentialing? Option A. Accept the physician's self-attested information for licensure and board certification, and rely on the department chair's informal inquiry to previous employers regarding malpractice history to expedite the process. Option B. Proceed with full primary source verification of all credentials, including licensure, board certification, and malpractice history, as per medical staff bylaws and policy, before granting any privileges, even temporary ones. Option C. Grant temporary privileges immediately based on the department chair's verbal confirmation of competence and the physician's self-attested information, with a commitment to complete primary source verification within 30 days. Option D. Issue temporary privileges based on the self-attested information and a promise from the physician to provide documentation later, while the Medical Staff Services Department focuses on verifying other aspects of the application first. The correct answer is B. Proceed with full primary source verification of all credentials, including licensure, board certification, and malpractice history, as per medical staff bylaws and policy, before granting any privileges, even temporary ones. Explanation. Scenario analysis. This scenario presents a common challenge in medical staff services, balancing the need for timely credentialing with the imperative to adhere strictly to established policies and regulatory requirements. The pressure to onboard a physician quickly, especially in a high-demand specialty, can create a temptation to bypass or expedite certain verification steps. However, failure to follow the defined credentialing process can lead to significant risks for the organization, including patient safety issues, legal liabilities, and reputational damage. The professional challenge lies in upholding the integrity of the credentialing process while managing stakeholder expectations and operational pressures. Correct approach analysis. The correct approach emphasizes adherence to the medical staff bylaws and credentialing policies, which are designed to ensure a thorough and consistent evaluation of all applicants. This aligns with the core principles of medical staff credentialing, which prioritize patient safety and quality of care. Specifically, the Medical Staff Services Department must verify all information provided by the applicant against primary sources, as mandated by accreditation standards and state/federal regulations governing healthcare providers. This meticulous verification process is the cornerstone of ensuring that only qualified and competent practitioners are granted privileges. The commitment to following the established policy, even when faced with external pressure, demonstrates professional integrity and upholds the organization's responsibility to its patients and the community. Incorrect approach is analysis. One incorrect approach involves accepting self-reported information for critical elements like licensure and board certification without independent verification. This bypasses a fundamental requirement of credentialing and exposes the organization to the risk of credentialing an individual who may not possess the necessary qualifications or who may have had their credentials revoked or suspended. This directly violates the principle of due diligence and the regulatory expectation of primary source verification. Another incorrect approach is to grant temporary privileges based solely on a verbal confirmation from the applicant or a previous employer, without completing the full credentialing file. While temporary privileges may be permissible under specific, narrowly defined circumstances outlined in the medical staff bylaws, they require a defined process and still necessitate subsequent thorough verification. Relying on informal assurances rather than a structured process is a significant deviation from policy and regulatory standards, increasing the risk of unqualified practitioners gaining access to patients. A third incorrect approach is to delegate the responsibility for verifying specific credentials, such as malpractice history, to the applicant's proposed department chair without a clear policy and oversight mechanism. While department chairs play a role in the peer review process, the ultimate responsibility for the accuracy and completeness of the credentialing file rests with the Medical Staff Services Department and the governing body. Unstructured delegation without proper controls can lead to inconsistencies and gaps in verification, undermining the integrity of the entire process. Professional reasoning. Professionals in medical staff services must adopt a decision-making framework that prioritizes policy adherence and regulatory compliance above all else. This involves 1. Understanding and internalizing the medical staff bylaws, credentialing policies, and relevant state and federal regulations. 2. Recognizing that the credentialing process is a critical risk management function. 3. Communicating clearly and proactively with applicants and stakeholders about the requirements and timelines of the credentialing process. 4. Documenting all verification activities meticulously. 5. Escalating any deviations or potential policy conflicts to appropriate leadership for guidance and decision-making. 6. Resisting external pressures that compromise the integrity of the credentialing process. 7. Continuously seeking professional development to stay abreast of evolving standards and best practices. Question 8. Operational review demonstrates that a hospital has recently integrated a new cardiology service line, including new physicians and advanced practice providers. To ensure continued accreditation compliance, what is the most appropriate immediate action for the Medical Staff Services Department? Option A. Assume that the current credentialing and privileging processes are adequate for the new cardiology service line, as they have been successfully applied to other specialties. Option B. Delegate the responsibility for ensuring accreditation compliance for the new cardiology service line entirely to the newly appointed Chief of Cardiology, without direct involvement from the Medical Staff Services Department. Option C. Postpone a formal review of accreditation requirements for the new service line until the next scheduled accreditation survey to avoid unnecessary administrative burden. Option D. Conduct a thorough review of the existing medical staff policies and procedures to identify any necessary modifications or new policies required to align with accreditation standards for the new cardiology services, and ensure all new practitioners are credentialed and privileged according to these updated standards. The correct answer is D. Conduct a thorough review of the existing medical staff policies and procedures to identify any necessary modifications or new policies required to align with accreditation standards for the new cardiology services, and ensure all new practitioners are credentialed and privileged according to these updated standards. Explanation. Scenario analysis. This scenario presents a common challenge in medical staff services, ensuring ongoing compliance with accreditation standards during a period of significant organizational change. The challenge lies in balancing the need for efficient integration of new services with the imperative to maintain the rigorous documentation and credentialing processes required by accrediting bodies. Failure to do so can jeopardize the organization's accreditation status, impacting patient care and reimbursement. The Medical Staff Services Department must proactively identify and address potential gaps before an accreditation survey. Correct approach analysis. The correct approach involves a systematic review of existing policies and procedures against the current accreditation standards for the newly integrated services. This proactive stance ensures that all documentation, credentialing, privileging, and ongoing professional practice evaluation (OP) processes are aligned with the accrediting body's requirements. This represents best professional practice because it prioritizes patient safety and regulatory compliance by embedding accreditation requirements into the operational workflow from the outset. It demonstrates a commitment to quality improvement and risk mitigation, aligning with the core mission of medical staff services and the expectations of accrediting bodies like the Joint Commission, assuming U.S. jurisdiction for CPMS. Incorrect approaches analysis. One incorrect approach is to assume that existing credentialing and privileging processes are automatically sufficient for the new services. This is a regulatory failure because accreditation standards are often service-specific and may have unique requirements for physician qualifications, training, and competency assessment. Relying on assumptions without verification creates a significant risk of non-compliance. Another incorrect approach is to delay the review until an accreditation survey is imminent. This is an ethical and professional failure, as it demonstrates a reactive, rather than proactive approach to quality and compliance. It places undue pressure on the department and the organization, increasing the likelihood of errors and potentially leading to adverse findings during the survey. It also fails to uphold the professional responsibility to maintain the highest standards of medical staff governance. A third incorrect approach is to delegate the review solely to the medical staff of the new service line, without oversight from the Medical Staff Services Department. While physician input is crucial, the Medical Staff Services Department holds the responsibility for ensuring consistent application of organizational policies and accreditation standards across all medical staff. This delegation without oversight can lead to inconsistencies and a failure to identify systemic issues, representing a breakdown in departmental accountability. Professional reasoning. Professionals in medical staff services should adopt a proactive, systematic, and collaborative approach to accreditation readiness. This involves 1. Understanding the specific accreditation standards applicable to all services offered by the organization. 2. Conducting regular internal audits and gap analyses of policies, procedures, and documentation against these standards. 3. Developing and implementing a plan to address any identified deficiencies, prioritizing those with the greatest impact on patient safety and compliance. 4. Fostering open communication and collaboration with medical staff leadership, department chairs, and other relevant stakeholders to ensure buy-in and effective implementation of corrective actions. 5. Maintaining a continuous improvement mindset, recognizing that accreditation is an ongoing process, not a one-time event. Question 9. Operational review demonstrates that the medical staff president has proposed revised privileging criteria for a specific surgical service, aiming to enhance patient safety by incorporating new competency assessments. The president has communicated these proposed changes directly to the relevant department chair for implementation. Which of the following represents the most appropriate course of action for the Medical Executive Committee, MEC, to ensure adherence to best practices and regulatory requirements? Option A. The MEC should allow the medical staff president to implement the revised privileging criteria directly, as their leadership role implies the authority to make such decisions. Option B. The MEC should review the proposed privileging criteria changes, verify their alignment with the medical staff bylaws and applicable regulations, and formally approve or reject them based on this review. Option C. The MEC should instruct the medical director to unilaterally implement the revised privileging criteria, as they are responsible for the operational aspects of medical staff services. Option D. The MEC should approve the proposed privileging criteria changes immediately, trusting the medical staff president's judgment and the department chair's understanding of the new assessments. The correct answer is B. The MEC should review the proposed privileging criteria changes, verify their alignment with the medical staff bylaws and applicable regulations, and formally approve or reject them based on this review. Explanation. Scenario analysis. This scenario presents a challenge in balancing the need for efficient medical staff leadership with the imperative to adhere to established bylaws and regulatory requirements for physician credentialing and privileging. The Medical Executive Committee, MEC, is tasked with overseeing the medical staff, but their actions must be grounded in the organization's governing documents and applicable laws. The challenge lies in ensuring that leadership decisions, even those made with good intentions, do not circumvent established processes designed to protect patient safety and maintain professional standards. Correct approach analysis. The correct approach emphasizes the MEC's responsibility to review and approve the medical staff president's proposed changes to privileging criteria, ensuring alignment with bylaws and regulatory standards. This upholds the principle of due process for practitioners and maintains the integrity of the credentialing and privileging process. The MEC's role as a governing body for the medical staff, as defined by most healthcare regulations and accreditation standards, e.g., Joint Commission, CMS conditions of participation, mandates oversight of such significant policy changes. Adherence to bylaws ensures that decisions are made through the appropriate channels, preventing arbitrary or unilateral actions by leadership that could compromise quality or lead to legal challenges. Incorrect approaches analysis. One incorrect approach involves the medical staff president unilaterally implementing changes to privileging criteria without MEC review. This violates the principle of collective governance and the established authority of the MEC as outlined in most medical staff bylaws. Such an action bypasses the checks and balances designed to ensure fair and consistent application of standards, potentially leading to challenges regarding the validity of the privileging decisions and exposing the organization to regulatory scrutiny for non-compliance with credentialing processes. Another incorrect approach is for the MEC to approve the changes without verifying their compliance with existing bylaws and relevant regulations. This demonstrates a failure in due diligence and oversight. The MEC has a fiduciary responsibility to ensure that all medical staff policies and procedures are legally sound and ethically appropriate. Approving criteria that are not in alignment with governing documents or regulatory requirements can lead to inconsistent application of standards, potential discrimination claims, and a breakdown in the organization's ability to demonstrate compliance during surveys or audits. A third incorrect approach is to defer the decision entirely to the medical director without any MEC oversight. While the medical director plays a crucial role in operational aspects of medical staff affairs, the ultimate authority for approving significant policy changes impacting privileging criteria typically rests with the MEC, as per bylaws. This deferral abdicates the MEC's governance responsibilities and bypasses the structured decision-making process intended to ensure broad consensus and adherence to organizational policy. Professional reasoning. Professionals in medical staff services must prioritize adherence to governing documents and regulatory frameworks. When faced with proposed changes to critical processes like privileging, the decision-making process should involve 1. Understanding the proposed change and its potential impact. 2. Consulting the organization's medical staff bylaws, policies, and relevant federal and state regulations. 3. Presenting the proposal to the appropriate governing body, e.g., MEC, for review and approval, ensuring that all compliance aspects are addressed. 4. Documenting the decision-making process thoroughly. This systematic approach ensures that actions are legally defensible, ethically sound, and contribute to a well-functioning and compliant medical staff. Question 10. Consider a scenario where a highly respected physician, who has been a long-standing member of the medical staff, applies for new surgical privileges. The physician's application is complete, but a review of their recent operative logs and peer references reveals some concerns regarding the volume and complexity of cases performed in the specific area for which privileges are sought, falling slightly below the established minimum threshold outlined in the medical staff bylaws. The chief of surgery, eager to retain the physician and recognizing their overall value to the hospital, suggests that the privileging committee consider the physician's overall reputation and long tenure when making their decision, implying a less stringent application of the volume criteria. As the medical staff services professional responsible for facilitating the privileging process, what is the most appropriate course of action? Option A. Advise the chief of surgery that the physician's application does not meet the minimum volume criteria, and therefore the privileges cannot be granted, without further discussion or consideration of alternative pathways. Option B. Ensure the privileging committee thoroughly reviews the applicant's qualifications against all established criteria, including the specific volume and complexity requirements, and documents any deviations or considerations made in relation to the bylaws and policies. Option C. Recommend to the privileging committee that the physician be granted the requested privileges based on their overall reputation and long tenure, as suggested by the chief of surgery, to avoid potential dissatisfaction and maintain positive physician relations. Option D. Proceed with granting the privileges as requested, assuming the chief of surgery's recommendation overrides the specific criteria outlined in the bylaws due to the physician's esteemed status. Correct answer is B. Ensure the privileging committee thoroughly reviews the applicant's qualifications against all established criteria, including the specific volume and complexity requirements, and documents any deviations or considerations made in relation to the bylaws and policies. Explanation. This scenario presents a common challenge in medical staff services, balancing the need for efficient privileging with the imperative to adhere strictly to established criteria and regulatory requirements. The challenge lies in ensuring that the privileging process remains objective, fair, and defensible, particularly when faced with external pressures or requests that might deviate from policy. The medical staff services professional must act as a gatekeeper, upholding the integrity of the privileging process while supporting the organization's mission and patient safety. The correct approach emphasizes a systematic and documented review of the applicant's qualifications against the established privileging criteria. This aligns with the fundamental principles of privileging, which require that privileges granted are based on an individual's demonstrated competence and ability to provide specific services. Adherence to the medical staff bylaws, credentialing policies, and relevant state and federal regulations, such as those from CMS for Medicare participating facilities, is paramount. This ensures that the privileging decision is evidence-based, objective, and legally sound, protecting both the patient and the organization. An incorrect approach that bypasses or inadequately applies the established criteria is professionally unacceptable. Failing to verify core competencies, relying solely on peer recommendations without independent verification, or granting privileges based on convenience or perceived need without documented evidence of qualifications, represents a significant regulatory and ethical failure. Such actions can lead to the granting of privileges to individuals who are not adequately prepared to perform the requested services, directly jeopardizing patient safety and potentially exposing the organization to legal liability and sanctions from regulatory bodies. The professional decision-making process in privileging should involve a thorough understanding of the organization's medical staff bylaws and credentialing policies, as well as applicable laws and regulations. When reviewing an application, the professional should systematically compare the applicant's submitted documentation, e.g., training, experience, certifications, references, against each specific privilege requested and the corresponding criteria. Any discrepancies or gaps should be addressed through further inquiry or a request for additional information. The process must be transparent, documented, and consistently applied to all applicants to ensure fairness and compliance. Question 11. The investigation demonstrates that a physician applicant for privileges has a strong recommendation from a respected department chair, who emphasizes the urgent need to fill a vacancy in their service line. However, a routine primary source verification for the applicant's medical education reveals a discrepancy in the dates of attendance that was not fully explained in the initial application. The Medical Staff Services Department is under pressure to expedite the credentialing process to address the staffing shortage. What is the most appropriate course of action for the medical staff services professional? Option A. Proceed with granting privileges after obtaining a written assurance from the department chair that the discrepancy is minor and will be addressed post-credentialing, while documenting the chair's input. Option B. Inform the department chair that the credentialing process will be delayed indefinitely due to the discrepancy, without initiating further investigation or resolution. Option C. Halt the credentialing process for this applicant until the discrepancy in medical education verification is fully investigated and resolved through primary source confirmation, regardless of departmental pressure. Option D. Expedite the credentialing process by relying on the department chair's recommendation as sufficient verification for the medical education, and proceed with other credentialing steps. The correct answer is A. Proceed with granting privileges after obtaining a written assurance from the department chair that the discrepancy is minor and will be addressed post-credentialing, while documenting the chair's input. Explanation. The investigation demonstrates a situation where a medical staff services professional is faced with conflicting pressures during the credentialing process. The challenge lies in balancing the organization's commitment to providing timely access to care with its paramount duty to ensure patient safety and adherence to established credentialing standards. The professional must navigate potential external influence and internal pressures while upholding the integrity of the credentialing process. The correct approach involves meticulously following the established credentialing policy and procedure, regardless of external pressures or perceived urgency. This aligns with the core principles of medical staff services, which prioritize thorough verification of qualifications, competence, and professional background to ensure that only qualified practitioners are granted privileges. Adhering to policy protects the organization from liability, upholds patient safety standards, and maintains the credibility of the credentialing process. This approach is directly supported by the regulatory framework governing medical staff credentialing, which mandates a systematic and objective evaluation of applicants. An incorrect approach would be to bypass or expedite certain verification steps due to pressure from a department chair or a perceived need to fill a staffing gap. This directly violates regulatory requirements for comprehensive credentialing and introduces significant patient safety risks. It also undermines the established policies and procedures, creating a precedent for future deviations and potentially leading to inconsistent application of standards. Another incorrect approach would be to rely solely on the applicant's self-reported information without independent verification. This fails to meet the fundamental requirement of due diligence in credentialing and exposes the organization to the risk of credentialing individuals who may not possess the stated qualifications or have a history of adverse actions. Such a failure constitutes a breach of professional responsibility and regulatory compliance. Professionals should approach such situations by first understanding the organization's credentialing policy and the relevant regulatory requirements. When faced with pressure, they should clearly communicate the established process and the necessity of completing all verification steps. If the pressure persists or involves attempts to circumvent policy, escalation to the appropriate leadership or compliance officer is crucial. The decision-making process should be rooted in a commitment to patient safety, regulatory compliance, and ethical conduct, prioritizing objective evidence and established procedures over expediency or external influence. Question 12. Upon reviewing a new physician's application for privileges, the Medical Staff Services Department notes that the applicant has completed all required training and education, but is missing a key document, a signed attestation from their residency program director confirming the completion of their training. The physician's start date is imminent, and the department chair has verbally assured the medical director that the physician is highly competent and essential for patient care coverage. What is the most appropriate course of action for the Medical Staff Services Department to ensure compliance with credentialing standards while addressing the urgent need for physician coverage? Option A. Advise the department chair that the physician's privileges can be approved based on their endorsement, and the Medical Staff Services Department will process the remaining documentation retrospectively. Option B. Grant temporary privileges based on the department chair's verbal assurance and the physician's self-attested completion of training, with the understanding that the missing document will be provided later. Option C. Issue provisional privileges that allow the physician to practice under direct supervision until the missing attestation is obtained and verified. Option D. Inform the physician that privileges cannot be granted until the missing attestation is received and verified from the residency program, and explore options for temporary coverage with a credentialed physician while awaiting the document. The correct answer is D. Inform the physician that privileges cannot be granted until the missing attestation is received and verified from the residency program, and explore options for temporary coverage with a credentialed physician while awaiting the document. Explanation. Scenario analysis. This scenario presents a common challenge in medical staff services, balancing the need for timely access to patient care with the imperative of thorough credentialing and privileging. The physician's urgent request, coupled with the potential for patient harm if care is delayed, creates pressure to expedite processes. However, bypassing established procedures or relying on incomplete information can lead to significant risks for the organization and patients. The core challenge lies in adhering to regulatory requirements and organizational policies while demonstrating responsiveness and good judgment. Correct approach analysis. The correct approach prioritizes patient safety and regulatory compliance by ensuring all necessary documentation is obtained and verified before granting privileges. This aligns with the fundamental principles of credentialing and privileging, which are designed to ensure that practitioners are qualified and competent to provide the services requested. Specifically, it upholds the Joint Commission standards, if applicable to the exam jurisdiction, and CMS regulations, if applicable, that mandate a thorough review of a practitioner's qualifications, including education, training, experience, and licensure, before granting privileges. This systematic approach mitigates the risk of unqualified practitioners providing care and protects the organization from liability. It also demonstrates a commitment to due process for the applicant. Incorrect approaches analysis. One incorrect approach involves granting temporary privileges based solely on a verbal attestation of completion of a residency program without independent verification. This fails to meet the standard of due diligence required in credentialing. Regulatory frameworks typically mandate verification of credentials from primary sources. Relying on verbal assurances bypasses this critical step, increasing the risk of credential fraud and placing patients at risk. Ethically, it compromises the organization's commitment to patient safety. Another incorrect approach is to defer the credentialing process entirely to the department chair, assuming their endorsement is sufficient. While department chairs play a vital role, they are not a substitute for the formal credentialing committee and medical staff services department's responsibilities. This approach abdicates the organization's responsibility to conduct an independent review, potentially overlooking critical information or discrepancies that the department chair might not be aware of or empowered to verify. It also bypasses established governance structures designed for objective review. A third incorrect approach is to grant privileges based on the physician's reputation or prior work at another institution without a formal verification process. While reputation can be a factor, it is not a substitute for verifying current licensure, board certification status, and any adverse actions or limitations from previous practice. This approach is a direct violation of credentialing standards that require objective verification of all stated qualifications and a review of the practitioner's history. Professional reasoning. Professionals in medical staff services must adopt a systematic and evidence-based approach to credentialing and privileging. This involves 1. Understanding and strictly adhering to all applicable federal, state, and local regulations, as well as accreditation standards and organizational bylaws. 2. Implementing a clear, documented process for credentialing and privileging that includes defined timelines and responsibilities. 3. Prioritizing verification of credentials from primary sources. 4. Ensuring that all requests for privileges are reviewed by the appropriate committees and leadership. 5. Communicating clearly and professionally with applicants and internal stakeholders regarding the process and any requirements. 6. Maintaining a commitment to patient safety as the paramount consideration in all decisions. When faced with urgent requests, professionals should explore options for expedited review processes that are still compliant with regulations and policies, rather than circumventing them. This might involve clear protocols for emergency credentialing that still require a defined level of verification. Question 13. Process analysis reveals that the Medical Staff Services Department is experiencing challenges in accurately capturing and verifying practitioner data for credentialing and privileging. Which of the following data collection and analysis techniques best represents a professional best practice for ensuring data integrity and compliance with regulatory requirements? Option A. Prioritizing the speed of data entry by using broad, unverified data fields and minimizing validation steps to expedite the credentialing workflow. Option B. Implementing a multifaceted approach that combines automated data capture from the electronic health record (EHR) with a structured manual review and verification process by trained credentialing staff. Option C. Collecting comprehensive data only at the time of initial credentialing and privileging, with no ongoing data collection or periodic re-verification processes. Option D. Relying exclusively on self-reported data submitted by practitioners during their initial credentialing application, with minimal independent verification. The correct answer is B. Implementing a multifaceted approach that combines automated data capture from the electronic health record (EHR) with a structured manual review and verification process by trained credentialing staff. Explanation. Scenario analysis. This scenario presents a common challenge in medical staff services, ensuring data integrity and accurate reporting for credentialing and privileging processes. The challenge lies in balancing the need for comprehensive data with the practical limitations of data collection and the potential for human error. Medical staff professionals must exercise careful judgment to select data collection methods that are both efficient and reliable, adhering to regulatory requirements and best practices. Correct approach analysis. The correct approach emphasizes a multifaceted data collection strategy that combines automated system checks with manual verification. This aligns with best practices for data quality management, which advocate for redundancy and cross-validation to minimize errors. Specifically, leveraging the electronic health record (EHR) system for initial data capture, and then implementing a structured manual review process by trained credentialing staff ensures that data is both readily available and thoroughly vetted. This approach directly supports compliance with regulatory frameworks that mandate accurate and up-to-date information for physician credentialing and privileging, such as those outlined by the Joint Commission, or NCQA, depending on the specific accreditation body applicable in the U.S. healthcare context. The systematic nature of this approach reduces the likelihood of overlooking critical information and provides a clear audit trail. Incorrect approaches analysis. An approach relying solely on self-reported data from practitioners without independent verification is professionally unacceptable. This fails to meet the standard of due diligence required in credentialing. Regulatory bodies expect healthcare organizations to actively verify information, not simply accept it at face value. This method introduces a high risk of inaccurate or incomplete data, potentially leading to credentialing decisions based on flawed information, which is a direct ethical and regulatory failure. An approach that only collects data during the initial credentialing process and does not incorporate ongoing monitoring or periodic re-verification is also professionally deficient. Credentialing is not a one-time event. It requires continuous assessment of practitioners' qualifications and performance. Failing to collect and analyze data throughout the privileging period can lead to outdated or inaccurate information being used for ongoing patient care decisions, violating standards of patient safety and organizational responsibility. An approach that prioritizes speed of data entry over data accuracy, for example, by using broad, unverified data fields or skipping validation steps, is a significant regulatory and ethical failure. The integrity of the data directly impacts patient safety and the organization's compliance with accreditation standards. Inaccurate data can lead to inappropriate privileging decisions, potentially endangering patients and exposing the organization to legal and financial repercussions. Professional reasoning. Medical staff professionals must adopt a systematic and rigorous approach to data collection and analysis. This involves understanding the specific data requirements mandated by regulatory bodies and accreditation standards. The decision-making process should prioritize data accuracy, completeness, and timeliness. Professionals should implement a combination of automated tools and manual verification processes, establishing clear protocols for data entry, review, and validation. Regular training for staff involved in data collection and a commitment to continuous improvement in data management practices are essential for maintaining compliance and ensuring the highest standards of patient care. Question 14. Examination of the data shows that a long-standing physician applying for reappointment has not provided updated documentation for their malpractice insurance coverage, which is a mandatory requirement in the organization's credentialing policy. The physician, a respected member of the medical community for over 20 years, has assured the Medical Staff Services Department that their coverage is current and that they have always maintained it. The physician also mentions their close personal friendship with a member of the governing body. What is the most appropriate course of action for the medical staff services professional? Option A. Approve the credentialing application based on the physician's assurance and long tenure, as it is unlikely they would misrepresent their insurance status. Option B. Inform the physician that the credentialing application cannot be processed until the required malpractice insurance documentation is provided, and explain the policy requirement. Option C. Advise the physician to discuss the documentation issue directly with the board member they know, suggesting that this relationship might expedite the process. Option D. Expedite the credentialing process by accepting the physician's verbal confirmation of malpractice insurance coverage, given their established reputation. The correct answer is B. Inform the physician that the credentialing application cannot be processed until the required malpractice insurance documentation is provided, and explain the policy requirement. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a conflict between a physician's perceived competence and objective credentialing data. The medical staff services professional must navigate this situation while upholding the organization's commitment to patient safety and regulatory compliance, which are paramount in credentialing. The pressure to accommodate a long-standing physician, coupled with potential personal relationships, can cloud judgment. Correct approach analysis. The correct approach prioritizes adherence to the organization's established credentialing policies and procedures, which are designed to ensure all practitioners meet defined standards. This aligns with the core principles of credentialing, which are to verify qualifications, assess competence, and ensure practitioners are safe to provide care to patients. The medical staff services professional has a duty to the organization and its patients to ensure that all credentialing decisions are based on objective, verifiable information and are applied consistently, regardless of the applicant's tenure or personal connections. This approach upholds the integrity of the credentialing process and mitigates risk for the organization. Incorrect approach is analysis, failing to verify the physician's current malpractice insurance coverage, and instead relying on the physician's assurance is a significant regulatory and ethical failure. Credentialing policies universally require documented proof of current malpractice insurance as a risk management measure and often a regulatory requirement. This failure bypasses a critical verification step, potentially exposing the organization to financial and legal risks if an untoward event occurs. It also undermines the principle of consistent application of policies. Approving the credentialing application based solely on the physician's long tenure and reputation, without verifying the specific requirements for malpractice insurance, is also an ethical and regulatory lapse. While tenure and reputation are considered, they are not substitutes for objective verification of all required criteria. This approach prioritizes subjective factors over objective evidence, creating an inconsistent and potentially unsafe credentialing process. It violates the principle of fairness and equal application of standards to all applicants. Suggesting that the physician's personal relationship with a board member should influence the credentialing decision is a severe ethical breach and a violation of conflict of interest policies. Credentialing decisions must be based on objective criteria and professional judgment, free from undue influence or bias. Allowing personal relationships to dictate credentialing outcomes compromises the integrity of the process, erodes trust, and can lead to the appointment of unqualified individuals, directly jeopardizing patient safety. Professional reasoning. In situations involving credentialing, medical staff services professionals must adopt a systematic and objective decision-making process. This involves 1. Thoroughly understanding and applying the organization's credentialing policies and procedures. 2. Prioritizing patient safety and regulatory compliance above all else. 3. Verifying all required documentation and information objectively and consistently for every applicant. 4. Documenting all decisions and the rationale behind them. 5. Seeking guidance from legal counsel or the credentialing committee when faced with complex or ambiguous situations. 6. Maintaining professional objectivity and avoiding personal biases or external pressures. Question 15. Performance analysis shows a physician applicant for medical staff privileges has disclosed a past disciplinary action from a state medical board in a previous state of practice. The applicant has provided a brief explanation of the event. What is the most appropriate next step for the Medical Staff Services Department to ensure compliance with state and federal regulations? Option A. Assume that HIPAA regulations prohibit the healthcare organization from obtaining any further information about the disciplinary action. Option B. Dismiss the disciplinary action as irrelevant without further investigation, assuming it does not impact current practice. Option C. Directly contact the state medical board where the disciplinary action occurred to obtain official documentation and understand the full scope of the action and its resolution. Option D. Rely solely on the physician's self-disclosure and explanation, assuming it is complete and accurate for credentialing purposes. Correct answer is C. Directly contact the state medical board where the disciplinary action occurred to obtain official documentation and understand the full scope of the action and its resolution. Explanation. This scenario is professionally challenging because it requires the medical staff services professional to navigate a complex interplay between state and federal regulations concerning physician credentialing and privileging, specifically when a physician's practice history involves disciplinary actions in another state. The challenge lies in ensuring compliance with both the Health Insurance Portability and Accountability Act, HIPAA, regarding the privacy of protected health information and state-specific medical board regulations that mandate reporting and verification of such actions. A failure to properly investigate and document the prior disciplinary action could lead to the granting of privileges to an individual who may pose a risk to patient safety, violating the core mission of the medical staff and the organization's commitment to quality care. Furthermore, misinterpreting or misapplying these regulations can result in significant legal and financial repercussions for the healthcare organization. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance through a thorough and systematic process. By directly contacting the state medical board where the disciplinary action occurred, the professional is engaging in the most reliable method of verifying the information and understanding the full scope of the disciplinary action. This aligns with federal guidelines, e.g., National Practitioner Data Bank reporting requirements, and state laws that often require verification of licensure and any adverse actions. This proactive verification ensures that the credentialing committee has accurate and complete information to make an informed decision about granting privileges, thereby upholding the organization's duty of care and its commitment to maintaining a competent medical staff. This approach also demonstrates due diligence and a commitment to ethical credentialing practices. An incorrect approach that involves relying solely on the physician's self-disclosure without independent verification is professionally unacceptable. This fails to meet the standard of due diligence required in credentialing and could allow a physician with a history of problematic practice to gain privileges without adequate scrutiny. It bypasses established regulatory mechanisms for verifying professional conduct and disciplinary history, potentially violating state laws that mandate such verification. Another incorrect approach, which is to dismiss the disciplinary action as irrelevant without understanding its nature and the specific state's reporting requirements, is also professionally unacceptable. This demonstrates a lack of understanding of the interconnectedness of state medical board actions and their implications for credentialing in a new jurisdiction. State medical boards often have specific requirements for reporting and investigating disciplinary actions, and failing to adhere to these can lead to non-compliance with both state and federal mandates. A third incorrect approach, which is to assume that HIPAA prevents the healthcare organization from obtaining information about the disciplinary action, is a misinterpretation of the regulation. While HIPAA protects patient health information, it does not generally prohibit healthcare organizations from verifying a physician's licensure status or investigating adverse actions reported by state medical boards, which are often publicly accessible or obtainable through formal verification processes. This approach would hinder the organization's ability to ensure a safe and competent medical staff. The professional reasoning process for similar situations should involve a structured approach. 1. Identify the core issue. A potential discrepancy or concern arises during the credentialing process. 2. Consult relevant regulations. Determine which state and federal laws and guidelines apply to the specific situation, e.g., State Medical Board regulations, HIPAA, NPDB requirements. 3. Gather information. Employ appropriate and compliant methods to obtain necessary information, prioritizing verification through official sources. 4. Analyze information. Evaluate the gathered information in the context of the applicable regulations and the organization's policies. 5. Document thoroughly. Maintain detailed records of all inquiries, information obtained, and decisions made. 6. Seek expert advice. If uncertainty exists, consult with legal counsel or experienced credentialing professionals. 7. Make an informed decision. Base the decision on a comprehensive understanding of the facts and regulatory requirements, always prioritizing patient safety and organizational integrity. Question 16. Operational review demonstrates a pattern of medication errors involving a specific physician, primarily related to dosage calculation for a complex intravenous infusion. The Medical Staff Services Department is tasked with addressing this issue. Which of the following approaches best aligns with regulatory requirements for patient safety and quality improvement? Option A. Advise the physician to cease prescribing complex intravenous infusions and refer them to a peer review committee for a formal reprimand, without further investigation into the circumstances. Option B. Immediately suspend the physician's privileges for medication administration until they complete a remedial training course on dosage calculations. Option C. Implement a hospital-wide mandatory retraining program on all aspects of medication administration for all physicians, regardless of their error history. Option D. Initiate a thorough root cause analysis involving direct observation of the physician's practice, interviews with nursing staff involved in medication administration, and a review of the electronic health record and relevant hospital policies for infusion management. The correct answer is D. Initiate a thorough root cause analysis involving direct observation of the physician's practice, interviews with nursing staff involved in medication administration, and a review of the electronic health record and relevant hospital policies for infusion management. Explanation. This scenario presents a common challenge in medical staff services, identifying the underlying causes of a recurring adverse event and implementing effective solutions. The professional challenge lies in moving beyond superficial fixes to a systemic understanding of the problem, ensuring compliance with regulatory requirements for patient safety and quality improvement, and fostering a culture of accountability without punitive measures. Careful judgment is required to balance the need for thorough investigation with the practicalities of implementation and the impact on medical staff morale. The correct approach, focusing on a comprehensive root cause analysis, RCA, that involves direct observation, interviews with involved staff, and review of relevant policies and procedures, represents best professional practice. This aligns with the principles of patient safety and quality improvement mandated by regulatory bodies such as the Joint Commission, if applicable to the exam's jurisdiction, assuming U.S. context for CPMS. An RCA systematically identifies contributing factors, not just immediate causes, allowing for the development of targeted and sustainable corrective actions. This approach respects the professional expertise of medical staff, while ensuring adherence to standards of care and regulatory mandates for reporting and remediation of adverse events. An incorrect approach that focuses solely on disciplinary action against the individual physician, without investigating systemic issues, fails to address the root cause. This is a regulatory and ethical failure, because it neglects the organization's responsibility to identify and mitigate system-level vulnerabilities that may have contributed to the event. It can lead to a culture of fear, discourage reporting of errors, and fail to prevent future occurrences. Another incorrect approach, which involves implementing a generic, one-size-fits-all policy change without understanding the specific context of the adverse event, is also professionally unacceptable. This approach is likely to be ineffective because it does not address the unique contributing factors identified through a thorough RCA. It represents a failure to apply due diligence in quality improvement efforts and may not meet regulatory expectations for evidence-based corrective actions. A third incorrect approach, which involves delaying the investigation and corrective action due to concerns about potential litigation, is a significant regulatory and ethical failure. Patient safety and quality improvement are paramount, and delaying action to address patient harm or potential harm is contrary to the core mission of healthcare organizations and the expectations of regulatory bodies. This approach prioritizes legal defense over patient well-being and can result in continued risk to patients. The professional reasoning process for similar situations should involve a structured approach. 1. Acknowledge and report the event according to organizational policy and regulatory requirements. 2. Initiate a formal RCA process, ensuring multidisciplinary team involvement. 3. Analyze findings to identify all contributing factors, both human and system-related. 4. Develop a corrective action plan that is specific, measurable, achievable, relevant, and time-bound, SMART, and directly addresses the identified root causes. 5. Implement the plan and monitor its effectiveness through ongoing data collection and analysis. 6. Communicate findings and actions to relevant stakeholders, including medical staff leadership and governing bodies, to foster transparency and continuous learning. Question 17. Analysis of a healthcare organization's credentialing process reveals that a physician applicant has a valid state medical license and has completed all required training as self-reported. However, the organization's credentialing committee is considering approving privileges without independently verifying the physician's malpractice history or checking for any board certifications beyond the initial license. Which of the following approaches best aligns with legal and regulatory requirements for medical staff credentialing in the United States? Option A. Expedite the credentialing process by approving privileges based on the provided documentation, as the organization is facing a critical staffing shortage. Option B. Rely solely on the physician's self-attestation of malpractice history and board certifications, assuming honesty and integrity. Option C. Independently verify the physician's malpractice history, confirm board certifications, and review all other required documentation as per the organization's credentialing policy and relevant federal and state regulations. Option D. Approve privileges based on the valid state medical license and self-reported training, as this meets the minimum requirements for initial licensure. The correct answer is C. Independently verify the physician's malpractice history, confirm board certifications, and review all other required documentation as per the organization's credentialing policy and relevant federal and state regulations. Explanation: this scenario is professionally challenging because it requires a medical staff services professional to navigate the complex interplay between state licensing board regulations, federal healthcare program requirements like Medicare/Medicaid, and the internal policies of a healthcare organization. The core challenge lies in ensuring that the credentialing process not only meets the minimum legal standards, but also upholds the organization's commitment to patient safety and quality care, while remaining compliant with all applicable laws. The professional must exercise careful judgment to avoid legal repercussions and maintain the integrity of the medical staff. The correct approach represents best professional practice because it prioritizes a thorough review of all applicable regulations and guidelines, including state medical board requirements, federal program participation rules, and the organization's own bylaws and policies. This comprehensive due diligence ensures that the credentialing decision is legally sound, ethically defensible, and aligned with the organization's mission. Adhering to these established frameworks protects both the organization and its patients by ensuring that only qualified practitioners are granted privileges. An incorrect approach that relies solely on the applicant's self-reported information without independent verification fails to meet the fundamental duty of care and regulatory mandates for credentialing. This bypasses essential checks for licensure, education, training, and competency, creating a significant risk of patient harm and exposing the organization to legal liability for negligent credentialing. Such an approach violates the spirit and letter of most credentialing regulations, which demand rigorous verification. Another incorrect approach that focuses only on meeting the minimum requirements of a single regulatory body, while ignoring others, is also professionally unacceptable. For instance, focusing only on state licensure without considering Medicare/Medicaid participation requirements for specific services could lead to a practitioner being unable to bill for services, or the organization facing penalties. This fragmented approach creates compliance gaps and potential operational disruptions. A third incorrect approach that prioritizes speed and efficiency over thoroughness. By expediting the review process without completing all required verification steps is a direct violation of due diligence principles. This haste can lead to overlooking critical information, such as disciplinary actions or sanctions, which are vital for assessing a practitioner's suitability. This not only compromises patient safety, but also exposes the organization to significant legal risks. The professional decision-making process for similar situations should involve a systematic, multi-layered approach. First, identify all relevant regulatory bodies and their specific requirements for credentialing and privileging. Second, establish clear internal policies and procedures that incorporate these external requirements and any additional organizational standards. Third, implement robust verification processes that independently confirm all information provided by applicants. Fourth, ensure ongoing monitoring and recredentialing processes are in place. Finally, maintain thorough documentation of all credentialing activities and decisions to demonstrate compliance and due diligence. Question 18. Process analysis reveals a pattern of increased patient falls within a specific unit, with initial data suggesting a higher incidence among patients cared for by a particular group of physicians. The Medical Staff Services Department has been tasked with investigating this trend as part of the hospital's Quality Assurance and Performance Improvement (CAPI) program. Which of the following actions best aligns with regulatory requirements and best practices for CAPI in this scenario? Option A. Immediately compile a report detailing the physicians associated with the increased falls and submit it to the state medical board for investigation, as this indicates a potential pattern of substandard care. Option B. Conduct informal discussions with the physicians involved to gauge their awareness of the fall rates and suggest they be more vigilant. Without formally documenting these conversations or initiating a structured review. Option C. Initiate a comprehensive review of the unit's fall prevention protocols, staffing levels, environmental factors, and patient acuity data, alongside a review of physician documentation and adherence to established fall risk assessment and management guidelines, to identify systemic and individual contributing factors. Option D. Focus the investigation solely on the individual physicians identified in the initial data, assuming their practice patterns are the sole cause of the increased falls, and recommend immediate disciplinary action. The correct answer is C. Initiate a comprehensive review of the unit's fall prevention protocols, staffing levels, environmental factors, and patient acuity data, alongside a review of physician documentation and adherence to established fall risk assessment and management guidelines, to identify systemic and individual contributing factors. Explanation: this scenario presents a common challenge in quality assurance and performance improvement, CAPI, within a healthcare setting, specifically concerning the medical staff. The challenge lies in balancing the need for objective data-driven improvement with the potential for perceived punitive action against individual practitioners, which can impact morale and cooperation. The medical staff services professional must navigate this delicate balance, while adhering strictly to regulatory requirements and ethical principles governing patient care and professional conduct. The correct approach emphasizes a systematic, data-driven, and collaborative CAPI process. It aligns with the core principles of CAPI, which mandate continuous monitoring, evaluation, and improvement of patient care and organizational performance. Specifically, it reflects the requirements of regulatory bodies that oversee healthcare quality, such as the Centers for Medicare and Medicaid Services, CMS, in the U.S., which mandates CAPI programs for certified facilities. This approach prioritizes patient safety and outcomes by identifying trends and implementing evidence-based interventions. It also fosters a culture of accountability and learning, rather than blame. An incorrect approach that focuses solely on individual practitioner performance, without a broader systemic analysis, fails to address potential underlying system issues that may contribute to adverse events or suboptimal outcomes. This can lead to a superficial fix that doesn't achieve sustainable improvement and may unfairly target individuals. Ethically, it can be seen as punitive rather than developmental. Another incorrect approach that involves bypassing established CAPI protocols and directly reporting concerns to external bodies without internal investigation and resolution is premature and undermines the organization's internal quality improvement mechanisms. This can lead to unnecessary regulatory scrutiny, damage the organization's reputation, and bypass opportunities for internal learning and correction. It also fails to adhere to the established governance structure for addressing quality concerns. A third incorrect approach that involves ignoring or downplaying identified performance issues due to personal relationships or fear of conflict is a significant ethical and regulatory failure. It directly compromises patient safety and violates the professional's duty to uphold the highest standards of care and to report concerns appropriately. This behavior can lead to serious patient harm and significant legal and regulatory repercussions for both the individual and the organization. The professional reasoning process for such situations involves a commitment to understanding and applying the organization's CAPI plan. Relevant regulatory mandates, e.g., CMS conditions of participation for CAPI and ethical guidelines. It requires objective data collection and analysis, a focus on system-level factors, collaboration with relevant stakeholders, including medical staff leadership, and a commitment to fair and transparent processes. When performance issues are identified, the focus should be on identifying root causes, developing remediation plans, and monitoring the effectiveness of interventions, all within the established CAPI framework. Question 19. Operational review demonstrates a consistent backlog in the credentialing and privileging process, leading to pressure from clinical leadership to expedite applicant reviews. Which of the following approaches best balances efficiency with robust risk management in this context, adhering strictly to U.S. regulatory frameworks and best practices for medical staff services? Option A. Rely primarily on the applicant's self-attestation for all credentialing information, with spot checking only for a small percentage of applicants to manage workload. Option B. Prioritize applicants based on their specialty's perceived demand, allowing those in high-demand areas to bypass certain verification steps to expedite their onboarding and service provision. Option C. Delegate the final approval of privileges for all applicants to the department chair, without requiring a detailed review of the credentialing file by the Medical Staff Services Department. Option D. Implement a tiered review system where applicants with extensive, verifiable histories of practice at accredited institutions undergo a streamlined verification process, while new applicants or those with gaps in practice history receive a more intensive review, ensuring all critical elements are verified against established policies and regulatory standards. Correct answer is D. Implement a tiered review system where applicants with extensive, verifiable histories of practice at accredited institutions undergo a streamlined verification process, while new applicants or those with gaps in practice history receive a more intensive review, ensuring all critical elements are verified against established policies and regulatory standards. Explanation. Scenario analysis. This scenario presents a challenge in balancing the need for efficient credentialing with the imperative to maintain robust risk management practices. The pressure to expedite processing without compromising thoroughness can lead to overlooking critical risk indicators, potentially exposing the organization to legal and financial liabilities, as well as patient safety concerns. Medical staff services professionals must navigate this tension by adhering to established policies and regulatory requirements, while also employing critical judgment. Correct approach analysis. The correct approach prioritizes a systematic review of all submitted documentation against established organizational policies and regulatory standards. This ensures that each applicant is evaluated consistently and that potential risks are identified and addressed proactively. Adherence to established policies and regulatory frameworks, such as those governing credentialing and privileging, is paramount in mitigating risk and ensuring compliance. This approach aligns with best practices in medical staff services, which emphasize thoroughness, accuracy, and adherence to legal and ethical standards to protect both the organization and its patients. Incorrect approaches analysis. One incorrect approach involves expediting the review process by relying solely on the applicant's self-reported information, without independent verification of critical elements like licensure, board certification, or malpractice history. This failure to conduct due diligence directly violates regulatory requirements for credentialing and privileging, which mandate verification of qualifications and professional standing. Such an oversight significantly increases the risk of credentialing unqualified or high-risk practitioners, leading to potential patient harm and substantial legal liability for the healthcare organization. Another incorrect approach is to bypass established peer review processes for certain applicants based on perceived urgency or reputation. This undermines the integrity of the peer review system, a cornerstone of medical staff governance and risk management. Regulatory frameworks and best practices mandate that all applicants undergo a fair and thorough peer review process to assess their competence and judgment. Circumventing this process creates a loophole for potentially problematic practitioners to gain or retain privileges, thereby increasing the organization's exposure to medical malpractice claims and reputational damage. A third incorrect approach is to document the credentialing process superficially, focusing on meeting minimum documentation requirements without capturing the rationale behind decisions, especially those involving risk mitigation or the need for further investigation. This lack of detailed documentation hinders future audits, investigations, or legal inquiries. Effective risk management requires a comprehensive and transparent record of the credentialing process, including any identified concerns, the steps taken to address them, and the final decision-making rationale. Inadequate documentation can be interpreted as a failure to exercise due diligence and can weaken the organization's defense in the event of litigation. Professional reasoning. Professionals should approach this situation by first understanding the organization's credentialing policies and procedures, which are designed to incorporate risk management principles. They must then cross-reference these policies with applicable federal and state regulations governing medical staff credentialing and privileging. When faced with time pressures, the professional decision-making process should involve assessing whether expediting a specific step would compromise the integrity of the overall process or violate any regulatory mandates. If a conflict arises, the professional must escalate the issue to appropriate leadership or legal counsel to ensure a compliant and risk-averse resolution, rather than making unilateral decisions that could jeopardize patient safety or organizational compliance. Question 20. Research into the most effective and compliant methods for medical staff services professionals to fulfill their continuous professional development (CPD) requirements for maintaining their Certified Professional in Medical Staff Services (CPMS) designation, which approach best reflects adherence to the spirit and letter of professional development standards. Option A, focusing on CPD activities that are broadly applicable to general professional development, such as basic leadership or project management courses, even if they lack specific relevance to medical staff services. Option B, relying primarily on informal learning, such as reading industry articles and discussing best practices with colleagues, without a structured system for tracking or verifying these activities. Option C, selecting CPD activities based solely on convenience and ease of completion, such as short online modules with minimal engagement, without regard for their educational value or relevance to medical staff services. Option D, engaging in a diverse range of professional development activities, prioritizing those that offer practical application and demonstrable learning outcomes directly relevant to the core competencies of medical staff services, and ensuring proper documentation of all activities. The correct answer is D, engaging in a diverse range of professional development activities, prioritizing those that offer practical application and demonstrable learning outcomes directly relevant to the core competencies of medical staff services, and ensuring proper documentation of all activities. Explanation. Scenario analysis. This scenario presents a challenge in balancing the need for continuous professional development, CPD, with the practical constraints of a busy medical staff services professional's workload. Determining the most effective and compliant methods for fulfilling CPD requirements, especially when faced with limited time and resources, requires careful judgment and adherence to established guidelines. The core challenge lies in ensuring that educational activities are not only completed, but also relevant, impactful, and demonstrably contribute to maintaining and enhancing professional competence, all within the framework of the Certified Professional in Medical Staff Services, CPMS, certification requirements. Correct approach analysis. The correct approach emphasizes selecting CPD activities that are directly relevant to the core competencies and responsibilities of a medical staff services professional. This aligns with the fundamental purpose of CPD, which is to ensure practitioners remain knowledgeable and skilled in their field, focusing on activities that offer practical application and demonstrable learning outcomes, such as attending specialized workshops on credentialing and privileging, participating in webinars on regulatory updates affecting medical staff, or engaging in peer-reviewed literature review on best practices in medical staff management, directly supports the maintenance and enhancement of professional competence as expected by the CPMS certification. This approach ensures that the time and resources invested in CPD yield tangible benefits for both the individual and the healthcare organization they serve, and it directly addresses the spirit and intent of CPD requirements. Incorrect approaches analysis. One incorrect approach involves prioritizing CPD activities that are broadly applicable to general professional development, but lack specific relevance to medical staff services. For example, attending a general leadership seminar or a course on basic project management, while beneficial in some contexts, may not directly contribute to the specialized knowledge and skills required for medical staff services. This fails to meet the core objective of CPD, which is to enhance competence in one specific professional domain, and could be seen as a superficial fulfillment of requirements rather than a genuine commitment to professional growth in the field. Another incorrect approach is to solely rely on informal learning without structured tracking or verification. While informal learning is valuable, CPD requirements typically necessitate documented evidence of engagement and learning. Simply reading industry articles or discussing best practices with colleagues, without a system to record the activity, the learning gained, and its relevance, would likely not satisfy the formal requirements for maintaining a professional certification. This approach risks non-compliance due to a lack of verifiable proof of CPD engagement. A third incorrect approach is to choose CPD activities based solely on convenience or perceived ease of completion, without considering their educational value or relevance. This might involve selecting online modules that offer minimal challenge or require little active participation. Such an approach undermines the principle of continuous learning and skill enhancement that CPD is designed to foster. It prioritizes ticking a box over genuine professional development, potentially leading to a stagnation of skills and knowledge, which is contrary to the ethical and professional standards expected of certified professionals. Professional reasoning. Professionals facing CPD decisions should adopt a structured approach. First, they must thoroughly understand the specific CPD requirements and guidelines associated with their certification, in this case, CPMS. Second, they should identify their current professional development needs and areas for growth, aligning these with their job responsibilities. Third, they should actively seek out CPD opportunities that are directly relevant to medical staff services and offer demonstrable learning outcomes. Finally, they must maintain meticulous records of all completed CPD activities, including evidence of participation and learning, to ensure compliance and to reflect on the impact of their professional development on their practice. This systematic process ensures that CPD is a meaningful and effective component of professional growth and certification maintenance.